Hi winners, hope you're doing good. This is Dr. Srikanth from Team Mdsconquer. And I hope you guys are settled down with the effect of Neet MDS 2025. In this series of videos, I basically want to discuss the questions or the question patterns which are given in the exam, along with the relevant source in which part of Mdsconquer it was discussed to you, either directly the question or the application part of the question. The main reason of providing these videos, number one, is to know the mode of preparation that we really require according to the questions given in the latest examinations. And second one, want to maintain the integrity of the students who took Mdsconquer as a priority. And you need to know where the questions are coming from and what is the work of Team Mdsconquer to you regarding these examinations. And of course, you guys are familiar that I'm going to start with endo. So let's start with endo as a first subject. So going with the question number one, a 14-year boy suffered a traumatic injury 5 years back. Upper central incisor has an open apex. The keywords in the question are open apex with a thin dentinal walls, periapical radiolucency. Upon investigations, there is no response to the vitality, non-vital. So this is classically, whenever you read this particular question, your mind will straight away hit a classical case of regenerative endodontics. A very good case of regenerative endodontics, which we have discussed in the bootcamp series videos also. Okay, that is 2 to 3 months before exam. But now the question is, which of the following is not a correct treatment option, which is not to be done. Okay, right? Open apex case, thin dentinal walls, periapical radiolucency, non-vital teeth. Okay, so what not to be done? Nicely, the first option was given as apexogenesis. Apexogenesis is done in vital teeth. Whereas the other options, yeah, non-vital, periapical surgery, non-vital, regenerative endodontics, non-vital. By just elimination, the answer for this question is A. Apexogenesis is done in vital teeth. It is not done in a non-vital teeth. Here the question has clearly given it's a non-vital teeth. First question, the answer is A. And when I'm taking bootcamp also, I clearly mentioned that this range of questions, this is the mode of questions that they're going to ask you in combination with endo plus pedo. Pediatric endodontics also, it's going to fall under the same pool. So Pakka, you'll be having a minimum of 2 and maximum of 4 questions. I've clearly mentioned when I'm talking about the last 10 days mandatory checklist to be done also. Okay, same. Again, you have 3 questions on this particular concept. So jumping into the second question. 10-year-old patient presented with a complicated crown root fracture, which means complicated crown root fracture means pulp is exposed. Pulp exposure is there. Then he is talking about the vitality. He's telling that the teeth is vital, nice, vital teeth, and an open apex case. Again, clearly I have given you, whenever you have a case, decide whether it's a vital or a non-vital. Okay, sometimes clinically they are going to tell you discolored, and that's conditions you have to take it as a non-vital. I clearly mentioned each and every point where the questions came in the examination. You have to decide the open apex or closed apex. One is radiographic way. Second one is description way. Third one is age of trauma during the patient. Age of patient during the trauma. And these are most commonly seen in the anterior teeth. Everything was scripted, and along the script, the questions came. Now the question is, it's a vital teeth open apex case, pulp is exposed, what to be done? And I clearly told, whenever you have an extraction option, 99% is extraction cannot be the answer, because extraction-based treatments are not performed nowadays. I clearly told, whenever you have endowala, operative stuff, extraction-based options, no need to think about it. Okay, right, extraction is eliminated. The next comes is pulpotomy, pulpectomy, and indirect pulp capping. Indirect pulp cappings are done when the pulp exposure is not there. Here the pulp exposure is clearly there, demarcated. Okay, right. So it cannot be option. Either you have to go for pulpotomy or pulpectomy. Pulpectomy is done in non-vital teeth. Pulpotomy is done in vital teeth. So it's a vital procedure. The answer is very simple. Then jumping into the next part. Next question. I clearly told, sometimes they may not give you the history. They may not give you the vitality, but they'll give a clinical feature. I clearly mentioned non-vital, clinical feature, discoloration. Clearly mentioned in the bootcamp series video. So many times discussed it. A 5-year-old boy complains of a discolored single teeth discolored, not all teeth. and patient is asymptomatic with a history of trauma. It is absolutely a non-vital teeth, but asymptomatic. Asymptomatic non-vital teeth is the best teeth for space maintainer, as it's a primary teeth. Age of boy is 5 years. Wait and watch would be the best treatment option, but you don't have wait and watch in the option. You don't have wait and watch, so you cannot wait and watch. So you need to go with the elimination method. Extraction, never. I never do extraction. And this is a non-vital teeth. I cannot do pulp capping. Pulp capping is done in a vital teeth. Pulpotomy is done in a vital teeth. Only procedure which is a non-vital is pulpotomy. I'm not very clear about the options. So these are like pulled from sources and as well as from the students, sitting together and discussing with them. If there is any correction either in the format of question or correction either in the options, do let me know directly on my WhatsApp number, or you can drop a message on the comment section of the video where it is being uploaded. Right, for this question the answer is pulpectomy. Okay, it's a non-vital procedure considering discolored teeth, discussed in your boot camp. Then comes to the next question, microsurgery. Okay, microsurgery, you have a nice video available on the website, video number 15. And the question is straight away from the video. And of course, this question was already discussed, given in your regular exams, as well as it was discussed in the offline students. For offline students, it's been discussed. Disadvantage of using an ultrasonic in performing a root and preparation. So whenever you do ultrasonic root and preparation, the major disadvantage is micro cracks. You can see in the diagram, nice micro cracks are there. Nicely it was discussed in the video. Ultrasonic tips, they lead to a disadvantage called as root fractures by causing micro cracks. Right, the answer is A, discussed in the offline center, as well as it is a straight away question from your smart videos. Then I'm going to the next question. Again, my favorite question of choice. Again in the boot camp, I have discussed clearly. Very important concept I told. Okay, composite restoration and a bleaching concept they are going to ask you. Straight away a question came. Okay, I told you either you have to wait for a few days for the regeneration of these bonding properties, or either you have to keep a catalase enzyme, which is a straight away line from your standard textbooks. If not catalase enzyme, you can use antioxidants. Antioxidants, particularly antioxidant is vitamin C, I have clearly mentioned. Okay, and I hope most of you have got the right answer. So what is the question? A non-vital after a non-vital bleaching, there is a compromised adhesion and polymerization of the composite resin while performing an aesthetic restoration. Which of the following can be used to enhance the properties when an immediate restoration is needed in this condition? Okay, right? The answer is vitamin C. Best answer is catalase. Catalase is not there. You have to go for vitamin C, which is again discussed in your boot camp series 2 to 3 months before examination. The next comes, okay, beautiful question. Of course, a constant repeat of INICET and a well discussed Radics, entomolaris, paramolaris were discussed so many times to you on the group, on the WhatsApp, in the offline, everywhere it is being discussed. And question is straight away and simple. There is no ambiguity in the question. Options were made very cool and composed. Okay, right? So one is, you can see extra mid canal. Okay. So that is how it is there. It's not only extra mid canal. The most important thing that we really focus on in the diagram based, whatever it is, you can see 3 canals here. And the other important aspect is you can see an extra root here. Okay, Okay, right? So it's very simple. It's extra mid canal is there, mid mesial is there, and entomolaris. Okay, a similar diagram, but not a clinical diagram. A similar diagram was there as a question in your website. Okay, so what is this? Radics, entomolaris. Clear description part is given what is entomolaris and what is paramolaris in your app. Okay, right? So this is a straight away question according to me. A very easy question. There's nothing to get confused. Options were made very cool and composed. You can easily answer them. The next comes again a trauma question. Trauma is a very important topic to be done. Stressed so many times for you. Okay, so trauma is an important topic to be done. A 10-year-old boy fall in the park, resulting in avulsion of an upper right central incisor. Before he reaches the dentist, the tooth should be kept in one of the following. Okay, of course, we have discussed so many times the best agent to carry the teeth is wire span, followed by save tooth, HBSS. Okay, and followed by, we have discussed milk. Milk has a carrying capacity of 3 hours, and followed by saliva. Saliva has a carrying capacity of 2 hours. This is what the sequence we have discussed. And of course, again, this is This is straight away AIPG 2016 question, okay, right, which is available on your website. Okay, so I mean, here you don't have this Viaspan and everything, but here the answer among the best, the answer is milk. Okay, right. So then comes thermoplastizer Gatapacha technique is contraindicated in which of the following condition? A simple common sense based question. The only tricky option what I have seen is backfilling. Okay, so we have already discussed in backfilling also. This technique is done in 3 parts, where the backfilling is one, and of course this particularly I have covered in the video. Okay, so it can be done in internal resorption case. When I'm talking about internal resorption pink teeth, I have discussed the mode of obturation that we regularly go is either by thermoplastizer Gatapacha technique, or you can use MTA based sealer. You can fill that void with MTA. Of course, she-shaped I have discussed. Okay, the flow and everything are better in the case of your alpha phase. Beta phase, the flow is not better. Alpha phase, the flow is better. Where you are going to use alpha phase is used in therma. Whenever you have beta phase is there, beta phase you heat it, it's going to convert into alpha phase. Therma, whenever you have therma, is going to be alpha phase. Alpha phase has a better flow properties. So they're asking flow properties. Whenever there is high flow, if an open apex case is there, you regularly don't do obturation in the open apex case until unless the apex is closed by apexogenesis or the apex is closed by apexification. So thermoplastizer Gatapacha or any sort of obturation technique, until unless you have an apical stop, we don't perform in the open apex case. So this is a very, very easy common sense question according to me. Okay, the answer is A. Of course, it's a part of our regular discussion. Then comes referred pain is carried by which of the following nerves? Maybe this question can be from OS or can be inclined to endo. Okay, anyway, I have started it, so I have kept in endo. Okay, so this is question from your GT11. So GT11 question, this is straight away question. Okay, the pain is referred to the adjacent teeth, which is nothing but the definition of referred pain. The answer is C fibers. Okay, I hope like most of you have hit it. So straight away direct question from our GT11. Okay, and I hope you guys have handled it well. So then coming to the 10th question. Okay, again this is a straight away question from your topic specific exams. That is your fundamentals of tooth preparation, conservative. So direct straight away question, cusp capping, and of course we have discussed this in many aspects. On the WhatsApp we have discussed, on the offline we have discussed, and of course it is there on the website also. And of course it's a repeat. Okay, it's a repeat question, not immediately, like it was repeated few years back. So cusp capping, the keyword in this particular question is cusp capping considered. It's not mandatory. Cusp capping is considered. Luckily, the same question was there, considering when we are going to consider the cusp capping. Okay, when we are going to consider the cusp capping, whenever the distance is more than half, from the primary groove to that of the cuspal tip, and it should be less than 2/3. Okay, so it should be half to 2/3 the distance from the primary groove to that of the cuspal tip. Option B. Okay, so again this question is a straight away from your topic specific exams which are available on the website. Okay, right, I hope we are done with 10 questions. So in the part 1, so we'll be updating you the next part in a couple of hours. Stay tuned to the website, and signing off, Dr. Srikanth from Team Mdsconquer. Take care and study well. And if you want any information regarding the upcoming batches that are going to start, so this is a contact number that you can contact. And Mdsconquer, as always stressing, it is a mentor-based preparation. Of course, you have app access and a website access, keeping your final exam into consideration. Wherever you want, you can give exams. Okay, so that is the reason why we provide both app and website access. And of course, we always suggest mentor-based preparation is the ultimate preparation for any sort of entrance exam. Take care. See you very, very soon.